Every single day, more than 2,000 Americans experience a stroke. Not a near miss, not a scare, but an actual cerebrovascular event that permanently alters their life. And here is what nobody tells you. In over 60% of those cases, the body sent a warning signal days, weeks, sometimes months before the catastrophic event. A signal so subtle, so easily dismissed, that the overwhelming majority of people ignore it completely until it's too late. That signal is balance disturbance. Unsteadiness on your feet. A moment when you reach for the wall, when you feel the ground tilt slightly. When walking in a straight line suddenly requires concentration. Most people blame age. They blame fatigue. They blame new shoes or uneven pavement. I'm here to tell you that in a significant percentage of cases, that dismissal is dangerous. Subscribe to Dr. Waterling right now and hit that like button. We're building this channel on one principle, giving you information that could save your life, but that nobody in a 12-minute office visit has time to explain. The healthcare system profits from treating strokes after they happen, not from preventing them. There's no billing code for teaching you to recognize your own warning signs. Let me be direct with you. Balance problems after age 50 are common, and yes, many of them are benign. But when balance disturbance appears alongside specific other signs, it becomes a medical emergency masquerading as normal aging. The problem is that most people, and tragically, many physicians, don't know which combination of symptoms transforms ordinary unsteadiness into a stroke prediction tool. I want you to understand exactly what's happening inside your skull when balance fails. Your sense of equilibrium depends on three systems working in perfect coordination. Your inner ear vestibular system sending spatial orientation data, your eyes providing visual reference points, and your proprioceptive nerves in your joints and muscles reporting body position. Your brain's cerebellum integrates all three information streams and sends corrective signals to your muscles within milliseconds. When you feel unsteady, one of those three input systems is failing, or the integration center itself is compromised. Now here's what matters for stroke risk. The cerebellum, that integration center at the base of your brain, receives its blood supply from the vertebro-basilar arterial system. This system is particularly vulnerable to atherosclerotic narrowing, small vessel disease, and microembolic events. When blood flow to the cerebellum drops even 20 to 30%, the first function to deteriorate is balance integration. Not cognition, not speech, not vision. Balance fails first. What does this mean for you? If you're experiencing new onset balance problems, you may be experiencing transient ischemic attacks. Small temporary blockages in the vertebro-basilar system, each one lasts minutes to hours, causes subtle symptoms that resolve completely and leaves no permanent damage. That sounds reassuring until you understand the statistics. 1 in 3 people who experience TIAs will have a full stroke within 1 year if the underlying cause is not identified and treated. And among those who do have a stroke after TIA, approximately 50% occur within the first 48 hours. The system you rely on for your health is not designed to catch this. Here's why. When you go to your doctor and say you've been feeling unsteady, what happens? In the majority of cases, you get a cursory neurological exam. The doctor asks you to walk heel to toe, touch your nose with your eyes closed, stand on one foot. And if you can perform these tests in the artificial environment of the exam room, you're told your balance is fine. So, maybe you get referred to physical therapy for fall prevention. Maybe you're told it's age-related vestibular decline. At no point does anyone ask the critical diagnostic question, when exactly does the unsteadiness occur? Because timing is everything. Balance problems that happen when you stand up quickly suggest orthostatic hypotension, a blood pressure regulation issue that's important but not immediately life-threatening. Balance problems that worsen in the dark suggest vestibular dysfunction. But balance problems that occur randomly, that come and go without pattern, that sometimes include other symptoms, even briefly, that is the signature of intermittent cerebrovascular insufficiency. That is your stroke warning. Let me tell you about Margaret, 67 years old, who came into my office convinced she needed new glasses. For 3 weeks, she'd been feeling slightly off balance, particularly when turning her head quickly. Twice she'd grabbed the kitchen counter to steady herself. No dizziness, no spinning sensation, just a feeling she described as being on a boat. She'd seen her optometrist who found nothing wrong. Her daughter suggested she was dehydrated and needed to drink more water. I asked Margaret 3 specific questions. First, did the unsteadiness ever come with any other symptoms, even ones that seemed unrelated? She thought for a moment and said yes. Twice she'd had a brief episode where her left hand felt slightly clumsy, like she couldn't quite grip her coffee cup properly. Each episode lasted maybe 5 minutes. Second question, did she have any risk factors for vascular disease? She had high blood pressure, controlled with medication. Her cholesterol was borderline elevated. Third question, did anyone in her immediate family have a history of stroke? Yes, sir. Her father had a stroke at 72. I sent Margaret directly to the emergency department with a letter stating concern for vertebrobasilar TIA. The CT scan was normal, as I expected, because CT scans are notoriously poor at detecting small posterior circulation events. But the MRI with diffusion-weighted imaging showed 3 tiny areas of restricted diffusion in her cerebellum, evidence of recent small strokes that had produced no permanent symptoms yet. The vascular imaging showed 70% stenosis of her right vertebral artery. Margaret received immediate treatment with dual antiplatelet therapy, statin intensification, and close blood pressure optimization. 6 weeks later, she had carotid imaging that showed additional disease requiring intervention. If she had dismissed her balance problems as age-related and waited even 2 more weeks, the statistical probability is that she would have experienced a major stroke. She would have lost her independence, possibly her life. Now, how do you know if your balance problems are dangerous? I'm going to give you a specific set of warning signs. These are not the classic stroke symptoms you've been taught. These are the subtle precursor symptoms that indicate your brain is experiencing intermittent oxygen deprivation. Warning sign number 1. Unsteadiness that appears suddenly and resolves within minutes to hours. If your balance has been gradually declining over months or years, that pattern suggests chronic vestibular aging or peripheral neuropathy. Concerning but different from stroke risk. But if you were fine yesterday, and today you feel unsteady for 20 minutes, and then it passes completely, that temporal pattern indicates a vascular event. Warning sign number 2. Any transient neurological symptom accompanying the balance problem. This includes brief weakness in an arm or leg, temporary numbness or tingling, momentary vision changes, slurred speech lasting seconds to minutes, or sudden confusion. Even if these symptoms resolve completely, even if they seem too minor to mention, they represent brain tissue temporarily deprived of oxygen. That is the definition of TIA. Warning sign number 3. Balance problems worse with head movement, particularly turning your head to look over your shoulder or tilting your head back. The vertebral arteries pass through the cervical spine and can be compressed with certain head positions, particularly if there's underlying stenosis. If you notice your unsteadiness specifically when reaching for something on a high shelf or backing out of a parking space, that mechanical component suggests vertebrobasilar compromise. Warning sign number 4. Risk factor presence. Age over 60, high blood pressure, diabetes, high cholesterol, smoking history, atrial fibrillation, previous TIA or stroke, family history of stroke. If you have balance problems plus 2 or more of these risk factors, your probability of cerebrovascular disease is high enough to warrant immediate evaluation. Here's what you need to do. If you are experiencing new onset balance problems, particularly if they're intermittent and come with any other neurological symptoms, even briefly, you need urgent medical evaluation. Not next week. Not when you can get an appointment. Now says, Urgent means within 24 hours. Go to an emergency department or urgent care center and specifically state that you're concerned about TIA. Do not let yourself be dismissed because your symptoms resolved. Resolution is typical of TIA. That's what makes it dangerous. The evaluation you need includes brain imaging with MRI, not just CT. CT misses most small posterior circulation strokes. You need vascular imaging of your carotid and vertebral arteries. You need cardiac monitoring to screen for atrial fibrillation. You need comprehensive metabolic panel and lipid panel. This is not excessive testing. This is appropriate risk stratification for someone presenting with concerning symptoms and risk factors. Now, for those of you who have had balance evaluation and were told your cerebrovascular system is fine, or for those who want to reduce your risk before problems begin, I'm going to give you a specific prevention protocol. This protocol addresses the 3 primary mechanisms of stroke risk: atherosclerotic plaque formation, blood pressure dysregulation, and blood hypercoagulability. The foundation is nitric oxide optimization. Nitric oxide is the molecule your blood vessel lining produces to maintain vascular dilation and prevent platelet adhesion. After age 40, nitric oxide production declines approximately 10% per decade. That decline directly correlates with stroke risk increase. You can restore nitric oxide production through dietary intervention. Take 100 grams, about 3/4 of a cup, of raw arugula. Take 100 grams, about 1 cup, of raw beetroot, peeled and chopped. Take half a lemon juiced. Take 1 clove of garlic, crushed. Blend all ingredients with 200 milliliters, about 3/4 of a cup, of water until smooth. Drink this within 30 minutes of preparation, first thing in the morning on an empty stomach. Here is the mechanism. Arugula and beetroot contain high concentrations of dietary nitrates. When these nitrates contact the bacteria on your tongue, they convert to nitrites. When nitrites reach your stomach acid, they convert to nitric oxide. Garlic contains a lysine, which enhances nitric oxide synthase activity. Lemon provides vitamin C, which stabilizes nitric oxide and prevents its degradation. This is not folk medicine. This is documented vascular biochemistry, published in peer-reviewed literature, including the Journal of Applied Physiology. The second protocol element is cerebrovascular exercise. Your brain vessels, unlike your limb vessels, cannot be directly exercised through movement. But you can enhance cerebral blood flow through controlled breathing that modulates carbon dioxide levels. Carbon dioxide is the primary regulator of cerebral vessel dilation. When CO2 rises, brain vessels dilate. When it drops, they constrict. Sit comfortably in a chair with your back supported. Close your eyes. Inhale through your nose for a count of 4. Hold your breath for a count of 7. Exhale through your mouth for a count of 8. Repeat this cycle 10 times. Perform this protocol twice daily, morning and evening. The breath hold increases CO2, causing cerebral vasodilation. The extended exhale activates parasympathetic nervous system, lowering blood pressure. This combination directly reduces stroke risk through improved cerebrovascular reserve. The third element is platelet stability. Elevated platelet reactivity increases clot formation risk. The most effective natural antiplatelet agent is omega-3 fatty acids from marine sources, specifically EPA and DHA. Take 100 grams, about 1 small can, of sardines packed in water. Drain the water. Mash the sardines, including the soft bones. Add 1 tablespoon of ground flaxseed, 1 tablespoon of extra virgin olive oil, juice of half a lemon, and black pepper to taste. Mix thoroughly and consume with whole grain bread or crackers. Do this 3 times per week. The sardines provide 5 to 2 grams of EPA and DHA per serving. The flaxseed adds alpha-linolenic acid and fiber. The olive oil contributes oleic acid and polyphenols. The combination reduces platelet aggregation by 20 to 30% within 3 weeks of consistent consumption, documented in the American Journal of Clinical Nutrition. For those over 65 or with multiple risk factors, add 1 additional intervention: cerebral autoregulation training through postural stress. Your brain maintains constant blood flow despite blood pressure changes through autoregulation. This system weakens with age and vascular disease. You can train it through controlled postural changes. Lie flat on your back for 3 minutes. Then sit up quickly and remain sitting for 2 minutes. Then stand up and remain standing for 2 minutes. Notice any lightheadedness, but do not push through severe dizziness. If you feel faint, sit down immediately. Perform this sequence once daily. Over 2 to 3 weeks, your autoregulatory response strengthens, reducing the impact of blood pressure fluctuations on brain perfusion. Now, the critical warnings. If you experience sudden severe headache unlike any previous headache, sudden weakness or numbness on one side of your body, sudden difficulty speaking or understanding speech, sudden vision loss in one or both eyes, or sudden severe dizziness with inability to walk, that is not a warning sign. That is a stroke in progress. Call emergency services immediately. Every minute of delayed treatment increases the extent of permanent brain damage. If you are taking blood pressure medication, blood thinners including aspirin, or diabetes medications, do not modify your regimen based on this video. The dietary interventions discussed work alongside medical treatment, not instead of it. Monitor your blood pressure if you implement these protocols, as they may enhance medication effects and require dosage adjustment under physician supervision. If you have a history of kidney disease, avoid high potassium foods, including the beetroot juice, without discussing with your nephrologist. If you have a bleeding disorder or upcoming surgery, avoid the omega-3 protocol as it affects clotting time. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers, because it will directly shape what I cover in future videos. If this information helped you understand your symptoms or gave you tools to protect yourself, send this video to someone you care about. A parent, a friend, someone over 50 with high blood pressure or diabetes. You may have just given them information that prevents a catastrophic event. Subscribe to Dr. Waterling if you haven't already. Every subscriber moves us closer to reaching people who need this information but will never hear it in a standard medical appointment. We're building this channel on one principle. Your health is your responsibility, and you're right. Das says to mans in the Satz. The system makes money when you stay sick. We succeed when you stay well. Balance problems are not inevitable. They are not normal aging. They are signals. Your job is to recognize which signals matter and act before the window closes. You now have that knowledge. Use it.